Assalamu alaikum wa rahmatullahi wa barakatuh, and very good morning to everyone. Thank you, Sister Safura. I would like to welcome everyone to the 5th plenary of our 3rd World Congress on Islamization, Integration and Islamization 2021, with the theme of mental health and well-being in the 4th Industrial Revolution. The plenary today will be addressing the theme of cyberpsychology and well-being in the age of 4th Industrial Revolution. So ladies and gentlemen, before we proceed further, I would like to do some housekeeping announcement. So first of all, as usual, please keep our microphone on mute throughout the presentation. We will have a 50 minutes of presentation by our honorable speaker, and then followed by 10 minutes question and answer session. So I would like to encourage everyone to pose all questions in the chat box. We will try to entertain each of the questions. So ladies and gentlemen, we are honored to have our very own speaker for today's topic. The title for today's presentation will be School Refusal, the Impact of COVID-19 Pandemic on the Internet Use and Mental Health of the School Children. Let me introduce you our honorable speaker of today's plenary. So Dr. Nora, Associate Professor Dr. Nora Madzin, is our very own senior consultant psychiatrist, as well as medical lecturer in Kulliyyah of Medicine. Dr. Nora, a person who's very close to us. She has been practicing psychiatry for the past 15 years, and she has been serving patients for the past 15 years locally and internationally. She had experience working in Qatar back in 2005, 2010. I'm sorry, 2010, 2015. And I must mention that she is one of the important person behind this World Congress, in which she is the Deputy Chairman of our World Congress, WCI 2021. Dr. Nora, she had attained her Master in Psychiatry back in 2004 from University Kebangsaan Malaysia. And then she had her postgraduate diploma in Applied Psychology from University of Liverpool back in 2014. So without further ado, I think Dr. Nora, you are already on the other side, Dr. Nora?
Inshallah.
Okay, I would like to welcome Dr. Nora to deliver her talk. Please welcome.
Assalamualaikum warahmatullahi wabarakatuh. Thank you very much, Dr. Nabil, for the kind introduction. Perhaps just a little bit of correction. I think I'm quite old. I've been in this field actually more than 20 years. But Alhamdulillah, until now, I still feel energetic and still wanted to do something for our mental health, particularly in this era. So thank you very much as well to all participants, ladies and gentlemen. For the last 2 days, we have been listening to a great lecture, philosophy, and looking at and trying to understand the Maqasid Sharia principle and harmonizing between this principle into our specialization. I mean, I've been to some of the rooms, a plenary parallel session, and a very good papers presented, and including and touching many areas, including law, construction, internet, Wi-Fi, and many things. And today is the last day of conference, and I will be presenting on a topic which is quite focused to look at mental health issues among a vulnerable person. It is among children and adolescents. They are the young, and they are our future leaders. If we fail to recognize their difficulties and what have this industrial revolution and the pandemic affect them, probably we will have a future leader which is cannot function as what they are supposed to when we leave this world. So we are hoping that with a little bit of awareness and contribution, we can save our generation. Right. So I'm going to share some slides here, and bear with me because we are going to some of the theoretical and some of the practical aspect that we can in terms of dealing and looking at these mental health issues among the school children, particularly this pandemic area. So I am still a clinician and seeing patients across the age, from the young until the old. Then, okay, maybe I need it's not functioning. Okay. So what is the Industrial Revolution make us? And how does this Industrial Revolution affecting us? It's actually controlled by the artificial intelligence. And our life has been sort of like changed, it's been changed, the way we work, the way we interact, the way the education system, the way that we live. And we cannot stop this post-industrial revolution. It's because globally we can't go to the moon, we can't go to the mountain just to run away from the artificial intelligence or whatever this revolution. So we have to face it. And what is happening? Education become digitalized, borderless, and virtual. Which is it is good, and it also have some negative impact as well. Infrastructure, AI in the system, we can use the MRTs, LRTs, and work from here and there without having to have a driver. I mean, and what is happening to the economy? We come to the sharing economy, such as for example, we have Grab service platform for personal car and also a public car. So anybody can pay and generate money because of this technology. And what else? It is in our health. It does facilitate data storage, diagnostic, and even some of the treatment. I mean, surgeon is using some technology. The surgical become not to say being done by a robot, but of course we need a doctors, a human to move this robot. But it does make our health system improve and reduce lots of difficulties. The employment, this is the thing that we are worried. The reduction of the employment due to automated function, and then job security, the feeling of whether I still have a work or not, will be in dilemma for some of people, and we can't stop production of the human being because people still need to marry, people still have to fulfill their drive. And what is the least affected, I mean not to say affected, but we can still feel secure, is the job who requires human touch, because the job that a robot cannot do. For instance, my job, so I don't have to worry probably, because the psychologists, counselors, some doctors, some people really need to understand. Maybe we can make a robot who can say good morning, how are you? But to respond back, to talk, I mean, there must be a very sophisticated software. And it is affecting all social class, whether it is high level or low socio-economic class. This is then the issue of what is artificial intelligence and versus human intelligence. So it is still considered artificial, and I guess it still cannot be the human intelligence, because I remember one article that I read that there is one the game, and this artificial intelligence so-called. So he won the game, but the intelligence probably don't have to be there because it's a program. So who is programming this artificial intelligence? Is the person, still a person. Okay. I think I need help for this. Okay. So now we go back. What is the fourth industrial revolution affecting the children? So technology comes into their play, education, and for positive development, and also possible detrimental effect. So they play with the when they are still in the process of developing physical, biological, speech, psychological, cognitive, communication, social, and moral development. The fourth industrial revolution changed their way of playing, their way of learning, teaching. Perhaps you can refer to my picture here. There's a group of students or children. It is a traditional way. And look at the picture below that. It is in the classroom nowadays, and the children bring their smartphone even to the school. They probably need, this is sometimes it's needed because of security comes, parents need to contact them. So it is in our life, it is our daily, and it is in our children's life. Then while we are trying to adapt with this fourth industrial revolution, same like me as well, then come with end of 2019, the pandemic come. So pandemic fear, the COVID-19 come and make everything as it is now. We are in the social new norm, and it actually gives lots of impact to many parts of the world, many persons, and many level of social status. It's affecting physical health, mental health. Yes, we are going to touch on it. This is in general. The economy, very slow. The tourism has to stop. The environment also affected by this because not many people can go out and look after, and we need to have some essential services to look after the environment as well. And social, the quarantine, the lockdown, new work, new norm, new working style. We are work from home, WFH, or sometimes we WFA, work from anywhere, anytime. I think everybody also tired because we are still adapting. We are still adapting. So this is a very normal things that we need to adjust. Virtual learning is also stressful to us, academician, to anyone, even the school children. They have to learn how to focus, and the university student, it's affecting as small as they are until as big as they are in higher institution. And we are scared, and we are bombarded by social media infodemic, whether this is true, that sometimes we become clueless whether we get the right information or the wrong information. So this is stressful. Every day, sometimes you look at your WhatsApp group, somebody posts something and ask, is it true? Any doctors can respond to this. Is the vaccine going to make us reduce our immunity? So this is some of the social media infodemic bombarded into. And I think I would like to see also we also not only become pandemic, but panicdemic as well. So everybody got panic in the beginning, but I think now with the third wave, the panic probably lesser, but we are almost in generalized anxiety every day. So no more like panic, but it's a generalized. Sorry. So this is what I've said just now. For industrial revolution, pandemic, COVID-19, and complicate to A, B, C, D, E, many changes, X, Y, Z. And if I have numbers here, we can add on. And everything become virtual. So many of the things, it's enhanced the virtual activities. So I'm going to bring you to study or to observe what are the associations through the case that I've seen in my clinic. A 9-year-old girl, youngest in the family, post-lockdown, school refusal. There's a behavioral change, always with smartphone, aggressive, agitated, restless, and sleep disturbances. Whenever she wasn't with her smartphone, and she ignored her meals. She even refrained from herself from going to toilet, and to the extent that she is peeping in the I mean, she's not in the appropriate place. She had poor focus to study and refused to socialize with friends. 1 or 2 friends comes to her house and she cannot wait for them to leave the house because she wanted to be with her smartphone. It was perpetuated by the brothers' gaming behavior because inside the house also, the family of 2 or 3 of them also busy and sort of like ignore her. So being the youngest and being as to be in the lockdown, she lose her routine. And there is no developmental issues. She has no problem prior to the lockdown, but problem started after the lockdown. What happened is during the lockdown, because of she has to go on online learning, and children, being a children, this is the period of where you discover many things in the world. So instead of going to some of the learning website, this girl was distracted and started to play game, and this gave her much more pleasure as compared to read books. I think learning and being children, what is they want? Play. Everything is play until they're 12 years old. Usually we say. Okay, so what is the So what is the diagnosis? That when she came to see me, I put there as internet game addiction, although this is under emerging measures and model, which is not yet accepted in the psychiatry fraternity because it's still under revision. However, it will be studying, it has been studied widely. Okay, the case number 2 is adolescent, 14-year-old boy, timid and having anxious trait. He has a social anxiety and mild depression that leads to school refusal before the MCO. And he chose to stay at home and cope with internet game. He spent mainly with smartphone. The absence of smartphone resulted in agitation. It changed his sleep pattern. The movement control order enhanced the behavior. He felt happy because he doesn't need to be in the, at least relief, he doesn't need to be in the school. However, something else come to him. He doesn't want to go to school post MCO, and there's a prominent anxiety symptoms. He sometimes self-harm to reduce anxiety, and he also have mild depressive symptoms. He knew that this is not acceptable behavior, but he just can't control it. He felt secure at home, and even he can go and involve in e-sport. And this is also much more rewarding because he can get prize. And this behavioral addiction towards internet game, it is complicated by the genetic loading in him, whereby uncle had a history of substance use. And when at that moment I put him the diagnosis of anxiety disorder with comorbid with depression and also the problem with internet game disorder, internet game disorder. Yeah. Okay. So what did I do? Yeah, it is not for the case number one. Is a girl. Is still. We can do behavior therapy. We set the goal, gradual approach. We give a relaxation technique, some anger management, and we reward for successful behavior that he gets. So it is gradually he was able to separate from the smartphone, and he started to coming back to the routine, and he went to school. But this cannot be done alone because it got to involve from the parent. It has been on constant monitoring, and we do some we get involved with the occupational therapists dealing with other relaxation, and the members of this family. The challenging here is the members of the family with similar behavior. I mean, the brother. So we try to psychoeducate the children will imitate, and she has loneliness. When she's the youngest, and there's a generation gap between her and her mother. So if nobody is looking and listening, so she will resort to these activities. What about the case number two? This is a little bit challenge, much more challenging because of we need to go really holistic approach, and we have to give the pharmacotherapy, the medication, and we have to work on the non-pharmacotherapy as well. Parent and also school involvement. Luckily, I think the school has been very, very supportive in terms of supporting this boy. And in fact, that although it is not much improvement that we can see until now, because of the closure of the school, prevented our plan for exposure therapy. So, however, we try to encourage him to go to the online education, online class. However, he really needs to control himself, not to be distracted to other website or especially the game, because the moment, in terms of the addiction, if you still have the source of addiction, probably it's very challenging to remove, to manage that. And there's a comorbidity because he has anxious traits originally, and there's a there's a social anxiety in the school. So this is a quite difficult and challenging. Until now, I managed to treat his depression. He's come back. He stopped her self-harming behavior, and we do some behavior therapy. And what makes our therapy is better, I think, because the children are still developing their cognitive function, and they are easy to accept if we can guide them in the proper and constructive way. So it's very important to be resourceful and how to have the skills of parenting, of monitoring, and the support from the teachers as well. So I just want to bring you to some of these biological conditions. What happened from the research is the behavior. It's not just change the behavior that you see, but it's also it is also the biological changes have been seen in some of from the research. So they found out the reduced gray matter volume at the middle frontal gyre, MFG, and reduced D2 receptor availability in the striatum. And everybody knows that dopamine is one of the neurotransmitters that play an action in reward, and it's a pleasure pathway. And this pleasure pathway, the dopamine activation, the moment we accomplish in doing something, achieve our goal, so the pleasure comes, the reward pathway also activated. And what we found here is this is what's happening with the behavior addiction. I'll give you an example. If you enjoy exercise, so because now we have exercise addiction, in which way? If they don't go for exercise, they started to have all this anxiety, restlessness, agitation. And when do we say that this is disorders? or it is a problem when it is affecting the social and occupational functioning. We can still do whatever we like to do, and as long as it doesn't disturb our whole function. The input control, the reduced gray matter impact cognitive control. So this is where the control cannot be done in terms of addiction. But how does it happen? Is it something due to toxin, or is this because of the effect of the behavior itself? Because remember, sometimes the emotion can influence our intellect, our akal, and the intellect also can influence our emotion and our behavior. So it is interacting, the cognition, the emotion, and the behavior. Okay, so now we go to this, what is happening now, some discussion. The pandemic, the closure of school and playground, it is increase in internet consumption. And research have shown that with the closure of school, the closure of playground, the closure of many activities actually triggered mental health issues. For instance, that you see in case one, social isolation and anxiety, stress upon returning to the school. And some of these children, they have this regressive behavior, such as they started to have tongue biting, they become clingy, they become unhappy because this is the disruption in their routine. Normally they go to school to play, to run, to jump. But what happened now when they go back to school? They have to sit on their chair. And depression and anxiety has been found in the children and adolescents. Internet addiction also found some of the studies reported as high as 24%. A study in Taiwan. It's not only triggered, but it also can perpetuate whatever mental health condition that these children has, because they lose their school routine. Normally they can go to the school and they can talk to the counselors. Survey in UK, 26% unable to get support. Although the school or the university has been doing some job in terms of tele-conversation, tele-counseling, but I guess to embrace in this new norm is not an easy. It's going to take some time. The relapse of substance use also high during this pandemic. And how to get this? Some of them can order this drinks from the internet, because you know the online shopping become a trend, and this is the one that they can get all this substance, yeah, especially some alcohol or beverages. Okay, so a pandemic also increases screen time, and this is make the children exposed to cyberbully, inappropriate content exposure, and the other complication will be the sexual internet addiction. Headache, neck pain, this is a physical complication because they have to hold to make sure that they are in front of the computer all the time, and the malnutrition because they forget they have to eat. Domestic violence, abuse, exploitation. It can be due to parental stress, family instability. Signs may be different. Younger children, clingy, tantrum, irritable, defiant. They won't listen to their parents. And some of them got nightmare. School refusal is one. And this is all partly contributed by their immature thinking. Their brain are still developed. And the older children, they are still looking for the identity. So because of the pandemic, they can't go out, they can see their friends physically. So there's isolation and boredom. So these are the some of the signs that we can find. So what to do? What to do? It needs to be an individual, a family, local community, government agencies, non-government agencies. We must work together. So the approach can be biological, can be psychological, can be social and spiritual aspect, not to forget. This is to make the whole sum of the human being. So why do I say the individual? Because each one of us are the change agent. So if we can give more attention at our individual level, we look at the contributing factors for the internet use among our children. So partly we are the adult is one of the contributing factors because of the generation now is the generation Z or alpha or beta. I think whatever we name this the generation, but the life is so stressful. So we have to change our chips in our brain as well. Those who are baby boomers, those who live in 1970s, we can't bring we can use the principle, but we can't give the example. How do we live last time? Because it is out of their mind. When they live, when they born, they are with the technologies, the artificial intelligence. Yeah. The biological, of course, this is our scientists, our doctors can help. And also the psychological, the psychotherapy, and how does all these things interact? MashaAllah, this is a very, very interesting to see because if you can see that our behavior just now, if you look at this also contribute by the brain changes as well as maybe some of these changes can be changed if we give some treatment. Do we really need to, let's say we give biological, we give the psychological, but the social environment is too stressful. Perhaps this is also can be a helpful things to help our children. Yeah. And the spiritual part, not to forget, because we are human beings, we are living in this situation. The spiritual part here is actually some of the values, spiritual values that can help in terms of how do we react, how do we see, and then how do we see our life now. So it is all interacting each other. And it is useful and important to approach this mental health situation. Okay, I just want to share, this is my something that I try to share. Why do I say individual and family coping? If you remember, from individual, we are the change agent, we change ourselves, we change our family, we change the community, we change the nation, then we change the world. For instance, like now, they say follow standard operating procedure during pandemic. So nobody can, if let's say everybody play their role, we don't have to send a police to check whether we are wearing our face mask, or we are following the SOP, because every behavior that we do, it must be governed either by value-based or family-based or any other thinking, any other motive that can help us to change. So why I say anchor here? This is just very simple, practical things that we probably want to use at this era. Acknowledge and accept. As I said, AI is with us. We acknowledge that. We acknowledge our own emotion. We acknowledge that we are in pandemic. So we accept this situation. I think probably the accept here is not just pasrah in Malay word, but it's redha. Redha, that means we are committed to change, right? And it's notice, be at this moment. We cannot be living the past. Okay, we look at our children now, we look at what's happening to them. Of course, we do the root cause analysis, but things that we can change now, better change now. We can't change the past. So this is where the spiritual comes later. I will share with you what does it mean by the spirituality, then how does it interact with sciences. The C is committed to change, compassionate, communicate each other, hopeful, because as a Muslim, as a human being, don't lose hope. And the hopeful the humility, the humor sometimes. This is things that can give us a peace, a peaceful heart, a peaceful mind. And I remember Tan Sri Professor Kamal Hassan talk about the spiritual heart. And being a scientist as well in my practice, the piece of heart you can is actually also interact with the physical heart. For instance, if we are we are anxious, we feel our heart palpitation, trembling. We can see the sweating comes, the cold climbing. This physical change. The heart is pumping more than usual. But when we are in at peace, the heart slow down, and the pumping of the heart regularly, normally, can send the oxygen throughout the whole body. But if it is disturbed, perhaps we will looking for the air. We probably think that we cannot breathe and we're going to die. Okay, so the hopeful, organize, prioritize, look at what is happening, at least in our family and then in our local community. At the end of the day, reflect what is the purpose of life and do what matters now, because we have to be mindful and things that you can change, we can change. And the purpose of life is to live in a divine and hoping that when we go back to see our Creator, Allah Subhanahu Wa Taala, we can bring all the good things, because we will leave this world, but we're going to go back. So this is what the Muslim believe. Yep. And being this under reflection, we can do spiritually many things. And when we talk about spiritual, I just want to add here that is being the faith. Some have faith and they have the spiritual, and they embrace into religion. But sometimes some of the literature also show that if without having have a faith, but some of the readings that you can still be spiritual when we are connecting to the universe. So this is the simple things that in order to change at our individual. And then we go to this, it's a job of everyone, integrated agency, working together. Mental health services are an essential part of all government responses to COVID-19. So they must be expanded and fully funded. So these are the issues. We probably see post-COVID. We don't know when we want to say post-COVID, because we are still in the era of pandemic. But we are expecting more and more people will have these mental health difficulties, issues because of the losing job. And we are afraid that our children, how they are going to start their school again as usual. Or maybe the usual thing is education online. We don't know. So another thing is empowerment of mental health and psychosocial support, Hpss. It is what has been suggested by WHO. At every level, every department, every workplace, every organization, empower this Hpss, give the proper budget, training the personnel, and try to ease some of the logistic issues. And we cannot work in silo, because the mental health is a public health issues, and it needs inter-agencies networking. Public Service Department, Social Welfare Department, Education Ministry, Health Ministry, the Technology, the Communication Ministry. We have to work and talk and walk the talk, not just listen to the theory, but not walk the talk. So it's a time to walk the talk. And we have to come back. How can we do this? If we can go back to the values that will change some of our behavior. I give you an example, the values of, we know that we are living difficulties, but we still have hope and we still have things to look forward to. Then social welfare probably wanted to look at those the marginalized population. The education can come up with the guideline and implementing and empowering the teachers, who the education, the people who is affected by the COVID-19 pandemic. And if everybody can work together here, we can give the best for our children, our next generation. Let's say the content of the internet. Perhaps we have to start to think about block some of the inappropriate content. So I can't do that because it must be rely on the other policymakers. And the children, they just click on and they will get and absorb because this generation is the faster generation, the fast generation. They can't wait. If the parents doesn't give them the answer for anything, they will go back to the social media. They don't know how to cook. They don't ask their parents anymore. They go to YouTube. This is a good thing, but sometimes it can be a disastrous because not just looking for the recipe, but you go to other inappropriate content. Okay, this is the framework for reopening school provided by UNICEF for every child. So this is our job to go back here and everybody probably being tired, but as I said, this is a time for anchor. We have to drop anchor. We have to, because anchor is very strong. So we're anchoring and supporting each other. I guess at the end, I would like to put one more thing. At the individual level that I mentioned just now, the psychotherapy, it's being said that when we talk about biological changes, the DNA genetic, DNA, apa tu? This is the bahasa Malaysia is apa tu, but I'm trying to look the better words. Yeah, when the mental health disorders much more can be seen as the interaction between biological, psychological environment. So this is between the nature and nurture. So one of the things that I'm trying to share here is the psychotherapy part. When we put, okay, biological is no doubt, we give some medication, it will stabilize the neurotransmitter. However, for the psychotherapy, with the patient come and talk and resolve their issues inside their mind. So they go for, they talk and they try to cope with some religious coping. And we have psychospiritual coping. What do we put the element in that is actually how do we see and how do we accept and how do we look at what are the anger, frustration. Then we try to instill the forgiveness, the acceptance, the redha, the tawakkal. So this actually has been said in the research nowadays. The psychotherapy, either individual or cognitive behavior therapy, psychodynamic psychotherapy, or psychospiritual therapy, it does influence the DNAs or the genetic transcription. And this is what they call it the epigenetic theory. So it is wonderful and amazing just by make our spiritual heart at peace, forgiveness, accepting and acknowledging our emotion and do whatever necessary with the prayers, dua, hope, and get ourselves being so important as one of the important and change agent in this world. So it does help into the reduction of the it does help in the reduction and make our physical diseases much more better. So with that, I thank you for your attention and whatever, I think I can answer some of the questions. So I pass back to Dr. Nabil.
Okay, thank you very much, Dr. Nora, for the very interesting and enlightening talk. I can see that your talk has created interest and curiosity among the audience, because as we can see, there are around 10 questions from the audience. So we try to entertain as much as we could. And the Secretariat has been kind to extend the Q&A session until 10 a.m. So let's go to the first one. Assalamualaikum. Thank you, Prof. Nora, for very nice presentation. I would like to clarify your advice regarding prevention and management of internet addiction at different age. So that's the first question, Dr. Nora.
Okay. Thank you for the question. So prevention is better than cure, and mental health is actually about not about mental illness. So mental illness is where we have to have a psychiatrist to diagnose, and some with help of clinical psychologists. And so every age has different problem, I can see, and we must go back to their developmental. So do we really understand what are the changes occur for every age group? For the children, from because human beings develop, they still develop, and we are still now, that's why we say we are still learning and learning. The thing is, the brain probably stopped develop at 25 brain age, but the brain and mind is different. So let's say in the adolescent and the children is the one that we are worried. Although we know that some of the, not to say some, I haven't seen adult population more than 25, in the 35 years have this internet gaming, but I do have seen them have another difficult situation whereby the internet game, the internet addiction, but on the porn side, the pornography is the adult population. Because the internet game disorder, addiction disorder can be divided into three. Yeah? The gaming, the sexual, and the other one is the emailing. I mean, there's some people, they don't feel nice. They have this tendency to answer everything, mails, WhatsApp groups. So because they have, they feel pleasure of putting up their mind. So let's say the focus of the gaming is on the children and young adult. So what we can do is, as I said, at the individual, there's no right or wrong, no hard and fast rule, but identify what is the issue. For all you know that these young adult and the children, they are having some developmental, the developmental process is going on. The issue is if the family, if the situation, so I put it this way, yeah? The children itself, the parents, I mean the environment, and the social, right? The social issues, like now we cannot stop pandemic, so we have to board down in the house. But what can the family do? So we have to have detox, okay? Is in the family detox from the phones or gadgets, not only the iPad, tablet, stop. We have to have this detox period in one day. So everybody just respectful that okay, this is the time, the family time. So if we can identify the factors, distraction, loneliness, not able to talk to the parents. Parents are busy, not busy in terms of busy with work, but maybe busy with other things as well. The family issues, the marital issues, it is actually interact, and it does impact and the children and the adolescent. So I guess the level that we need to identify is prioritize, identify, and look the different age children, adolescent, they are different. Adolescent is the period where they want autonomy. So they won't listen to their parent as much as they listen to others. And this is the fact, this is the normal development. So give them some autonomy, let them talk. If they never say no to them, listen first. If let's say we say, you must come to me, now stop that. We have to go to them. So it is thus a good, because the adolescent is where the period of they want to develop their sense of identity. And they probably want some say. And according to the children, it's okay because everything just need to do by playing. From birth until 7, until 11, if we can play with them, they are happy. And how to do that? The gadget to play. So we have to become like them as well. Sometimes that is okay. Is our children, doesn't matter. We have to be clear that the children and the adolescent is the what we call it, the the operational thinking, the intellect. The children is the pre-operative, they're cognitive. What they see is what they believe. But the children, so this is where I think to answer this may a long structure, but just make sure that the structured activities and according to their age is difficult. Memang you have to tackle at the individual sometimes. But just to general principle, accept that, never turn away them.
Okay, thank you, Dr. Nora. Hopes your answer, it answered the question. So the second one comes from Sister Liana. So she has made a statement. Probably she wants your comment on it. So she said that mobile games adopt freemium concept. Freemium concept basically means that it's a combination of free and premium. Basically, if you want to download the games, it's free, but you can upscale it if you want more. So she said that it makes people addicted and also spend lots of money on microtransaction. Even adults are affected. So what's your comment on it?
I do totally agree with you with that because of, and remember, the higher we achieve, the dopamine reward pathway will activate it. So sometimes when you get pleasure, dopamine activated. Pleasure, then at one time when people lose control, they come to the schizophrenic state. When schizophrenia is, the dopamine is very, very high, right? And everything becomes real. So we thought that we are in that game sometimes. So be careful with the biological changes that can occur because of the behavior. And I think I totally agree with you. You got free, premium. And I say, okay, we have money, we can buy that. And every step, we just increase our behavior.
Okay, thank you, Dr. Nora. So the third one comes from Brother Azrul. In terms of sport addiction, I clarified with him, it's actually sport, the real sport, not e-sport. So which age group would be affected more? Any suggestion to cope with it?
Okay. I don't have a data, but let me phrase here, as I said, that the addiction to the exercise obviously is the adult population, because the children cannot still under control, but in the adult, you are controlling your own self. So that's the what is the next question just now?
He asked about which age group will be affected more. Any suggestion to cope? Any suggestion to cope with it?
All right. Any suggestion to cope? First, need to realize that this is a problem. When we have this cycling, maybe, or riding, cycling, or even going to gym. So regardless, we have to know what is the sign of addiction. The sign of addiction is most of the time we are busy in the activities. We probably forget our job, our children, our family. And if we didn't go to gym, we start to feel restless. If we didn't go to cycling, we spend most of our money, time to be in this activity. And even if you have fracture of the leg, you still want to run. So it becomes irrational. So this is the addiction, when the people lose control. And then by definition as well, in terms of disorders under psychiatry, also we say substance use disorder, substance addiction, you are having, if you didn't get it, you get withdrawal symptoms. And every time you keep on increasing, this is what you call tolerance. So tolerance, withdrawal, that is a sign of addiction. So to cope with that, come back, identify, and we have to do detox.
Okay.
And sometimes the medication does help, apart from the other behavior and spiritual part.
Okay, thank you. So moving to the next one, Sister Suhana asks if there is any kind of therapy that you ever prescribe to your patient, which doesn't involve meeting people, probably considering the current pandemic. So yeah, therapy that involve less interaction with people.
Therapy, less interaction with people. Yeah, I guess nowadays we are up to that. But one thing about therapy, probably the mixture is much easier, and we got to help. I just want to, and anything in this world, you have bad and you have side effect. So if let's say we want to opt for the does not involve interaction, perhaps I cannot imagine typing the answers through WhatsApp. For general info, yes, but when it is involved some issues like very difficult, we probably need to listen to the voice, because and look at the face sometimes. Because this is what we are doing now. We have to opt to the tele consultation, but somehow some of the cases we still have to see face to face.
Okay, we still have some more minutes to entertain the question, Dr. Nora. I'm skipping a few questions so that I can combine two or three questions together. So the next one comes from, good morning, Dr. Nora. I'm Li Wei, journalist from Bernama. I have two questions. So the first one, most of the time, the children will use the gadget alone without the guidance of parents. As a result, they are exposed to various content such as misinformation, fake news, hatred speech through social media. Any tips for the parents to filter or control the usage of internet or social media among their children? That's number one. And number two, what do you think about using social media such as TikTok, YouTube for online teaching among teachers to the children? Before, yeah, that's number two. So maybe in number one, you can also answer whether there is any guideline for the usage of internet among children. Is there any age limit? Yeah. Is the question clear to you, Dr. Nora?
Yeah, I can read that. Thank you very much, Liu. Number one is how to filter the fake news and hatred speech through. There's no other way except to be with our children. How do we do that? It's actually, we cannot be with them 24 hours, but make them feel you are there for them. The trust, the security, the children needs to have secure base. When this secure base started to develop as early as they were born. So when they are interacting, the children need to be feel secure so that they can explore the world, and they always have their secure base whenever they are having a problem. But what is happening is, if let's say we do not be with them, okay, now we know that this is something is not nice, it's not good, this is what's happening to our children now. So forget about penyesalan, the regret about I could have done better last time. Now we focus on what we can do now. Some guidelines, yes, I think apart from the technology control, I mean some of the TV, some of the computer, they have their ways of controlling the internet. Another thing that I normally ask my patient, my client is, we work in this way. We have one target. So each of the behavior, we identify what is the goal. So let's say they cannot be on the internet all the time, with the internet all the time. So we must give them chance, because this is what we also, if we take away from them, they feel that they're losing their control. So give them chance to be or to have their time, but also there must be a limitation and a structured activity. If I cannot be with my smartphone, what can I do? So we have to be creative. To play or to run, to jump, let them be the music, fill up their time with other things. But the reward is, okay, you can have 2 hours, and this is the limitation, and this is the contract that we do. And if we can always be with them, occasionally we cannot just go and snatch from them. They will not respect you, because the population now, the children nowadays, they really need parents to respect them. Then the parents respect them. They also wanted to respect. So by the modeling of this, we say you can't go to this website, but we are the one who's also watching that website. So there are things that the children and the adult need to know, what is bad, what is good. So be with the children, listen to them. Don't ever, if they show something, and discuss. If they are adolescent, then make it the discussion is much more interactive. So I also have 2 girls in my house, but what we normally can do is actually discussing and go according to their level of understanding. We can't be using macam anjing dengan kucing, or we can do some, we cannot give them some phrases ke apa kita panggil itu peribahasa ke, because some of them cannot up to that understanding yet for 2-3 years old, because this depends on the cognitive as well. And so I guess the tips is actually to be with our children most of the time. And what do you think about using social media? YouTube, TikTok? Oh, this is a very good question, because I think online teaching among teachers to the children, we are in this 4th industrial revolution. Whatever is good, take it and use that. Because it may not be suitable for me last time, but I have to change my chips as well, that the education needs to be much more creative and need to tackle their mind. So I guess everything, if we do it in moderation, because even the good things also have their side effect. Medication we give side effect, YouTube side effect, TikTok side effect. So I guess this is something that everything, if we do it with cautiously and with limit, inshallah, that's very good. So I have no objection about using this social media as well, as long as the content is appropriately vetted. Yeah.
With regards to the guideline, is there any standardized guidelines or limits in terms of hours for gadget for children?
I think so. Yeah, we have. We can refer to the website. I think, if I'm not mistaken, we have put there's a guideline being written by many of the mental health providers as well.
Okay. Thank you, Dr. Nora. The next question, probably this is the last one, comes from Dr. Karima, I think. Assalamualaikum warahmatullahi wabarakatuh. Thank you, Prof. Nora, for the interesting topic presented. My question is, do we need to worry if our children still listen to us, interact well with their surrounding, i.e. siblings, environment, and friends, but spend a lot of time playing e-games, especially at night. So I think this comes from a mother who concerns about the welfare of their children. Yeah.
Okay, this is a good question as well, because it's very practical. Children listen to us, interact well with their surrounding, sibling environment, and nothing disturb them. They got everything's good. They didn't forget their roles as a Muslim, as a student, spend a lot of time playing game, especially on night. This is probably not good because it disturbs their sleeping time. But what I'm saying here is it is no need to worry if they are functioning, but we must worry about their sleeping time. That's because we need everybody knows, right? The sleep is one of the mental health booster. Not booster, maybe a treatment as well. We must have a good sleep to make sure that we can function. That's why in Islam also say that nighttime is for you to rest, and then Allah even the guideline in Islam too. Before Zuhur, we have this called the sleeping shortly, nap, Kulliyyah, something that. So that is actually what has been said, that we must make sure that we have a good sleep. So we have to not to worry if they are functioning, but just look at the sleeping issues.
Okay, thank you very much, Dr. Nora. I think that would be the last question. Again, I would like to thank you for your for the talk. I think it has benefited a lot of people, and thank you, the audience, for your cooperation and the overwhelming response for our speaker. With that, I would like to pass the microphone back to Sister Safura. Thank you very much. Assalamu alaikum wa rahmatullahi wa barakatuh.
Yeah, thank you.